Welcome, everyone. I am delighted to bring to you Dr. Trina Dorrah. She's an internal medicine physician, a coach, a mom, a good friend, a mental health advocate, and so much more. So I'll have Trina introduce you to us, and I'll also say this is going to be about mental health, in particular eating disorders. So our trigger warning will be, we will be discussing eating disorders, and whenever we discuss mental health, there are some things that trigger people, and we'll be mindful to try to reduce those triggers. But if you're noticing yourself being triggered, please feel free to turn off this video and make sure that you seek the help and support that you need. So Trina, I'll have you introduce yourself to us.
Yeah, so I'm Trina. I am an internal medicine physician. I practice as a hospitalist. That's what I've done my whole career. And I also did a fellowship in quality improvement. So I work in quality in my health system as well. I've done patient experience before too. So basically anything. It's a small community hospital. So I like to help. I like doing different things, because I feel like when I do other things outside of medicine, it makes me enjoy medicine more. So I'm always the person kind of volunteering to be on the committee or help out, just so I can have something different. And then in 2020, I also became a life coach. So that is what I do. And like I said, I'm married, I have 2 kids.
That's excellent. And this is such a great time for us to be meeting. So May is Mental Health Awareness Month. We also just got off of the ACE conference, which if you are not familiar with that conference, it was a conference for women physicians and dentists. ACE stands for Authenticity, Courage, and Empowerment. Trina and I got to know each other quite well from shared experiences of eating disorders. And this has been a really big milestone for you, Trina. And I'd love for you to share something that we'll be discussing today.
Yeah, so on May 4th, 2021, that was the day that I entered treatment for my eating disorder. And so there are different levels of treatment, but the level of treatment that I did is called the partial hospitalization program. So it was every day, about 10 hours a day, and I was in the program for 6 weeks. So I entered it on May 4th, 2021. And then on May 4th, 2022, I met with my therapist, this therapist I've been meeting with ever since I left treatment. And she said that she thought that I had progressed enough where I no longer needed to meet with her on a regular basis. So now it's just as needed. If I need her, I can call her back. But otherwise, she feels like I've made enough progress.
And this is such a huge deal for anyone that has struggled with an eating disorder or that knows someone with an eating disorder. You know, just the levels of acknowledging, I think I might have a problem, to seeking help, that in alone is something to celebrate. And then to come and to devote all of the amount of commitment to yourself and to your recovery. I certainly know there's been a lot of ups and downs. And in thinking of how we met and that experience for you of that moment that you asked for help that you wrote about in your KevinMD article, The Hidden Burden of Shame. Can you tell us a little bit about how that went for you?
Yeah, so I have had an eating disorder for quite some time, but I feel like it's evolved over the years. And the thing that I was seeking help for was more binge eating behavior that had started since the pandemic, or gotten, much worse since the pandemic started in 2020. And so I tried seeing therapists in the past. I'd actually gone to a couple of eating disorder therapists in the past, and it didn't really take. But I think part of the problem was insurance maybe didn't really cover mental health like it does now. So I remember the very first eating disorders therapist that I went to see. Let me do this that way. So the very first eating disorders therapist that I went to see, I only got 6 sessions covered by insurance. And so I went to see her 6 times, and then that was it. And now I know that's not enough to really correct a serious eating disorder. And then one more time, when I was in my 20s, I saw a therapist one-on-one, and it got better for a little bit, but same thing, I didn't really get the level of treatment that I needed. So whenever I finally did decide to seek help, I actually just asked around. I asked on a Facebook group of other women physicians in town. I was like, where do adults go if they have an eating disorder? And so that was where I first learned who I needed to call for help. But it does still take, I think, some persistence, because the first time I called and I was just like, I need help, the person who answered the phone was like, well, yeah, I mean, you don't usually just come in here first. You need to go find an outpatient person. And I'd already tried that. And so I got really discouraged. So I probably went for another month or two, just continuing binging like every day, because I was like, oh, these people can't help me. And then finally, like, I got desperate. And so I remember when I called back, I was like, please, please help me. I was like, I am desperate. I need help. And then the person who answered the phone that time was, much more receptive.
Yeah, and this is highlighting such a concern for people with struggling with eating disorders. One, in our society, a lot of disordered eating behaviors are normalized. So it can be really hard to acknowledge, like, I think I'm having a problem. Can you highlight what are some flags that you recognize, say this is more than, I mean, I would even say this is more than society, but I think even society has caused destructive behaviors. But how did you say, like, I need help? What were your flags?
Right. So I think whenever I noticed that every morning I would wake up and I would say, okay, today I'm not going to binge. Today I'm just going to eat, my regular food, whatever that is that I had planned. And I couldn't even make it till 9 o'clock, 10 o'clock. And it wasn't like I just was eating off plan, which now I have very different opinions about eating plans, but it wasn't that I was just eating off plan. It was just that I was eating so much. I wasn't hungry. I was eating way more than I needed to feel full. And it just got to the point where I couldn't even go a few hours without engaging in the behavior. And so that was whenever I really knew, okay, I need help. But another thing that really stood out to me, and I want to make sure I bring this up. So as part of my life coach training, I did get trained on using thought work to try to help with weight loss. And so I tried that, right? Like, so I really, really did try examining my thoughts, sitting with cravings and urges and not giving into them, and just really trying to feel my feelings and all the things that I was taught through my life coach training. And I would see other people posting that, oh, this was the missing piece for me. I found this program. I'm managing my thoughts. Weight loss is easy. And then for me, every time I still would try to do those things, I would just go back into eating disorder behavior. So I was not sure. I was like, either something's wrong with me or something's wrong with this program. Mm-hmm. I now have beliefs that the program isn't the best either, but because other people, and you never know what other people are doing and if they're struggling, but in my mind, other people were having success, whereas I was trying the very same program and I was binging even more. And so that was another kind of clue for me, where I just felt like I was doing something different than what I saw a lot of other people doing. Although, of course, you never really know.
Yeah, and this is such a great point to highlight. The role of an eating disorder in a person's life is a coping skill. And when we relate it to, when we think about dieting and people think, oh, it's a very benign process, I'm going to eat less and exercise more. And for a person that's struggling with an eating disorder, can you identify the role of the eating disorder in your life?
It basically dominated my whole life. And as the years went on, it got worse. And again, I talk about the pandemic a lot because that's really when everything became out of control. And I think it's because eating disorders are often used to help people feel a sense of control. And so I would use my eating disorder all those other years, I think, to kind of get control, as I was going through college or going through medical school or residency. But I never felt as scared, I guess, or as out of control, or that I did not have the ability to control things as I felt whenever COVID first started, because I'm a hospitalist. So working from home wasn't an option. So at the beginning of COVID, almost all the other doctors went home, but those of us who work in the hospital, like ER, ICU, hospitalists, we were there and, we had no vaccines and we didn't really know. We thought we were going to die. And everybody was at work just talking about how they were going to die, and we couldn't find enough PPE and, all of those things. And we were hearing stories about physicians dying. And so that stress and the fear just became so much. And the only way I knew to control it, and it wasn't even conscious at the time, but the way I was trying to get some sense of control back, because I felt like I had lost so much control, was through the eating disorder. And for me, that eating disorder ended up kind of leaning much more towards binge eating disorder, even though I've had characteristics of other eating disorders throughout my life, but the binge eating was really what got my attention. And I think it was when I started gaining a lot of weight that was also when it got my attention, because I noticed how much weight I had gained because of how much I was eating.
Yeah, and I'm thinking like it all comes back to that emotional. So I think when we're communicating, it's often eating disorders have a shared similarity depending on how a person's relationship is with food. If it's to either reduce the amount they're eating, or eating food makes them feel better in a way that controls their anxiety, like that's the similarity, is that it's not about the weight in terms of a person's intentional weight loss. It's usually a manifestation of, I'm feeling a certain way, and if I don't eat, I feel better, or if I eat, I feel better. One's not better than the other. The shared experience of the eating disorder as a coping skill, which understandably, like that hospital setting, I know for me, COVID was really challenging, and we hear about the increased rise in eating disorders in the general population during the pandemic. And that's really highlighting that eating disorders often increase when people feel out of control as a way to control something. And there's been a lot of misconceptions about eating disorders, and sometimes people are judged whether it's their weight is too low, their weight is too high. And we surely want to highlight, like, this is not meant to be judged. This is, showing an example of the role of an eating disorder in a person's life as the coping skill, with a sign could be the weight changes, but the core issue is that relationship with food. And again, under that is what's truly going on for that person, and how can we help support that person. And so when you were starting to get help, what kind of things were you what kind of resources were helpful for you?
Yep. Before I answer that, I just wanted to mention, based on what you were just saying, that eating disorders aren't really about the food. I think a lot of people think it's about the food. So then if somebody's anorexic, they're like, I don't understand. Why can't you just eat more? Or like in my case, I don't understand. Why can't you just eat less? But it's not about food. It's about what's going on in your brain. And that's why you have to fix what's going on in your brain to be able to fix your relationship with the food. But then in terms of resources, what I'm going to tell you is I've had several people, now that I've been sharing more, people have started reaching out to me, and I'm sure the same thing has happened to you. And I hear similar stories. It's like, we know something's wrong, but maybe we don't quite know what's wrong. So we're trying, especially as physicians, we're trying to fix it through going into obesity medicine, for example. That was something that I thought about. I was like, I don't know what's wrong with me, but maybe if I become an obesity medicine physician, then I can figure it out. And then I thought about lifestyle medicine. I was like, again, I'm not sure what's wrong with me, but these principles of lifestyle medicine sound really good. So, maybe if I do that, then I can figure it out. Or maybe if I hire a coach, or maybe if I hire a weight loss coach. And I did hire a weight loss coach as soon as the pandemic started, and it was the most traumatic experience ever. And then I joined a program that I found online, and I read a book. And so, I was trying all these things. I was listening to podcasts about binge eating. So I was trying to figure it out, and nothing was working. And so that was whenever I just finally asked in that Facebook group of other physicians, I was like, does anybody have any idea what to do to help an adult who has an eating disorder? And thankfully, there was a treatment center right here in town, and several of the physicians wrote back and they said, this is where you need to go. And that was sort of what started that journey.
This is highlighting such a valid point in the weight stigma. So eating disorders are often, if a person is severely underweight, they're more apt to get eating disorder care. Whereas somebody with an eating disorder that might come in with a higher weight, larger body size, might get offered the exact tools that are exactly wrong for them: diet, weight loss. And so this is highlighting something that really upsets me inside. And even, you know, we were talking back to insurances. When I developed an eating disorder, it was when there were two eating disorders that were known: anorexia and bulimia, and there were BMI criteria. And in order to get treatment, I had to hit the BMI criteria, which was years into struggling with an eating disorder. So this weight-based stigma that invalidates people's struggle, the societal diet culture, which perpetuates eating disorder behaviors and then often normalizes them. And then we shift to medicine, where there's a weight stigma within medicine, which can further kind of, it's, you know, that term gaslighting that would get thrown around. Sometimes I feel like it's gaslighting. Like, is there something wrong with me? I'm told that I should champion what I'm doing. And as, you know, as I know, part of the binge cycle is that restriction, and we feel empowered when we can go through that, only for it to be extraordinarily detrimental.
Right.
And having people that they think it's a good thing to comment on our bodies when we are becoming smaller, and how that just really impacts our ability to do the thing that we know is really important for our recovery. Which kind of leads into the questions of, what did you notice as you were starting to lean into the eating disorder treatment, or kind of the ups and downs of that treatment?
One of the things that I first noticed was just relief that I wasn't alone. So I entered this program. There were, I think, 10 of us in the program, 10 adults in the program together. And there was one other person who had binge eating disorder. Everybody else either had anorexia or ARFID, the avoidant restrictive food intake disorder. But I still found some commonalities, because like you said, it's about the mental health aspect. Maybe we're responding to it differently, but we all still had similar struggles. And so that was just such a relief to be around other people who got it, and then have the therapists and the dietitians who understood eating disorders. And even the psychiatrist who was there was an eating disorder psychiatrist. Even the general internal medicine physician they had who was monitoring us, you know, worked in eating disorders. So the whole team of people were very, very knowledgeable. And I had actually seen a dietitian before, you know, in my constant quest to lose weight, which had gone on for years. I had seen a dietitian, and she didn't put me on a diet, but, you know, the typical, this is how many calories are in this is how much fat, this is what your plate should look like, you shouldn't eat more than this. And as I was going through treatment, I learned, even from my ED dietitian, depending on the dietitian you go to, the advice they give you could be very harmful for your eating disorder. And so it's kind of like what you were saying about physicians. As a physician, I could tell a patient, hey, you need to lose weight, not even knowing maybe why they have all the weight on their body in the first place, like how I had it from the binge eating. Then they start losing weight through unhealthy means, maybe purging and restricting. And then you're right, they go to the clinic, and the clinic is like, oh, great, you lost weight. And they're getting encouraged. And then maybe other people, because all of our friends and family are so interested in losing weight and diet culture, they see the person losing weight, they keep encouraging it. Nobody ever knows that they are encouraging harmful behavior.
And I also think too, my eating disorder started in my adolescence near puberty. And I naturally have a more muscular body. And so when I was becoming smaller, it was championed. And at that time too, there was this Hollywood glamour and this fascination with anorexia. And I remember it became such a keen part of my identity. And it was an identity that was held on a pedestal at a time. And it's disgusting to me now, because of the harm that it does, but it's a very similar type of an oppressive pedestal that diet culture often places on people that desire to be smaller. And when I step back to say why, when I became smaller, I was lifeless. I didn't have enough energy to do anything. My quality of life was so poor. I have osteoporosis in my 30s. The things people don't talk about, the things people don't think are going to happen to them. A year ago, we're celebrating your amazing accomplishments. And I can also attest to a year ago, I almost passed away from my eating disorder, which is why it's so important for us to say, like, these small things that people are talking about and the things that they think benign and the things they think won't happen to them. And even when it comes to when people have binge purge behavior, like those things can cause sudden cardiac arrest. These mental health disorders are nothing to play around with because they do have physical ramifications sometimes. And even if they don't, just because people are dealing with eating disorders that don't have physical issues, that doesn't mean you're not struggling. That doesn't mean you don't deserve help. The moment you think you need help, please go get it. Because I often think with insurance, they make you really be struggling until they start to recognize, oh, you might have a problem. And if we can catch people that just say, oh, I would like help, and offer that, like, please get support.
And it's important to know any gender, any race, any age, and any body size can have an eating disorder. So it isn't just young, thin, white women. Although there were a lot of those women in my treatment whenever I was there, that's not all who, those aren't the only people who are suffering. So I think a lot of times other people are overlooked because nobody assumes they have an eating disorder. So I've never really been thin except for a very brief amount of time in my life where I was barely eating anything. But still, a lot of other years when I wasn't traditionally thin, I was still restricting my food intake quite a bit. But I think because I wasn't thin, probably because I'm Black, nobody really thinks of it as, oh, well, maybe she has an eating disorder. And that's even something that I've kind of opened my mind to as well. Just that anybody can have an eating disorder, no matter what they look like or their gender or sexual orientation or any of those things.
Yeah, and there has to be such a big process of unlearning. And why we're talking about now, right? Eating disorders are mental health illnesses. And often at my time of healthiest appearance is when I feel most ill because we feel, right? Like I have to feel my feelings when I'm not using eating disorder behaviors, or even if I am, people can be, they look super, super healthy, quote unquote healthy. And the mind, it's Dr. Kara Pepper has great, like, asking, how are you doing with food? How are you doing with exercise? Like, what's your relationship with those two things? And for me, I can say I wasn't always honest about my reply, because for me, anorexia has been like an addiction. And if I'm not ready to give it up, I may not be forthcoming. And that whole ability to give somebody self-compassion and a safe, they want, to go into a doctor's office where we feel like we're going to be judged and weight shamed or invalidated. We may not want to be honest, and that's not because we're lying. We just don't feel safe, or that person is able to really help us. And so I'm grateful that you've been able to access resources that are eating disorder informed, because not everybody is. And
one thing I was going to say that you just said, I do think it can be a struggle getting to the point even where you're willing to admit to yourself that maybe there's a problem and go and get help. And because I think you're right, like there's a lot of denial that goes into it. It's very easy to tell ourselves, no, I don't have an eating disorder. Or sometimes I would say, oh, it's not that bad. It's not really causing that many problems. Or I'd say, well, I'm not anorexic, so then I'm okay. Like you can always come up with something if you're trying to hold on to the eating disorder. And that's another thing I really learned a lot about in recovery was what they call the ED voice. And so it's like there's my voice, Trina's healthy voice when she's thinking properly. And then there's the eating disorder voice. And so the eating disorder voice would be the one saying, lie to the doctor, don't tell them. They're going to try to put you in treatment. You're not going to be able to have this eating disorder anymore, or this eating disorder is great. It helps us. And that's a really hard voice to get rid of. And I still struggle with it because, like I said, there was that time period for 3 years when I was very thin, and I looked, I looked amazing according to society's standards, and I would get a lot of compliments on how I looked. And it's still a battle even now sometimes in my brain, because I would love to look like that again. The ED voice will just say, are you sure you want to, stick with this recovery thing? Because if you go back to what you were doing before, then you can look like that. If you stay on this recovery pathway, then you have to look like you look now. And so it's a battle for sure to overcome the ED voice and kind of fight it away on a regular basis.
Yeah, this is a question I get asked a lot, and I'm very forthcoming with parents that might have, that had a person that passed away or they lost touch with. Is part of my eating disorder voice. I have, I told you, I'm like, I deal with that crap every day still, and it's in my head every day, and it's not rational. The things that go through my head and the image that my mind wants, that associates with comfort and safety, is not a sustainable body. And it's one that I often recognize is when I feel like I want to cower down and get into a hole. It usually is coming up when I'm super stressful. I'm feeling like I'm overexposed. I'm being vulnerable, traveling, and so moving. It's like you recognize times where you might need increased support. And typically, from what I know, and again, we're not eating disorder trained individuals, we're people with lived experiences. But during increased stress, like we were talking about, times of where we don't feel in control, transitions, no matter what that looks like, those are the times where I say, oh, I'm the rational, self-compassionate side of me thinks I need to tuck in with somebody that can call me out right now, and that can be my eyes, because that eating disorder voice in our head often it's very compelling.
But the ED voice in our head, and then also everything your friends and family are saying too. Like, so many people have friends and family in their lives who are constantly talking about weight loss in various different ways. I mean, maybe they're outright saying, I need to lose weight, or they're saying, oh, I can't eat that, or look at me, I don't need to gain any more weight, or that has too much sugar, or whatever the messages are. And so you've got your own internal voice you're battling. Then you have all these other people who are saying, this is what you should do. No sugar, no flour, and, things like that. And you're like, it sounds good, but, should I really go down that pathway? And so it's hard trying to decide who to listen to.
Yeah. And it's so interesting to try to seek out people that are voicing on the contrary. And so with that being said, can you tell us about your podcast and your Facebook group and your coaching programs, what all you've got going on right now to be that voice of change?
Well, yes, I recently changed my podcast name to Diet Culture is BS. And I think I kind of chose that. And I know you and I have had conversations about it, but I think you're right. So there's so much more attention, I think, that needs to be brought to diet culture. And I think a lot of people don't really know what it is, or they don't really understand. They don't understand how pervasive it is. They don't understand that they have beliefs. Like, we all carry around these beliefs just because that's what diet culture told us that we should believe, as to what's attractive, how much you should weigh, all of these different things, and what you should eat, when you should eat, how many hours in between you should eat. And I really thought, okay, where can I help to make the most impact? And so I definitely, much like you, think sharing my story is helping to make an impact. And I've started noticing people messaging me and say, thank you for sharing your story. I think I might have an eating disorder, or you're really helping me with my body image. And so I definitely was like, okay, I can have an impact by being open and honest. But then I also kind of said, I would really love to just kind of combat the messages, because I was trapped in diet culture for almost my entire life. And I didn't know I was trapped. And I was convinced that my weight the diet culture way of thinking was correct. I was just so convinced that that was the way to live. And now that I'm on the other side, it's like, no, life is so much better when you're not focused on diet culture. I think that's a hard message to get to people. And so I want to be someone that brings that message to other people, but at the same time, it's not easy because I've tried it already with some people and they're not interested in hearing it. So,
And it is so much easier I'll speak on personal, we don't want to speak for other people, but it's so much, I was thinking about this because we were talking, why is it so hard for people to hear anti-diet culture remarks and statements? I'm like, one, I'll say the best combatant for me for diet culture is self-compassion, which is such a hard thing to explore and to accept. And after beating ourselves up, it's really, it's foreign at some points. But when I was in therapy, when I was a surgical intern, one of my eating disorder trained therapists, I was dealing with quite severe depressions. We weren't even working on my eating disorder, though it had started to arise as a coping skill for depression. And he said, I've never met someone that's struggling with eating disorder that has very profound self-compassion. I'm like, that's the ticket. Because if we develop such profound self-compassion, we won't want to treat ourselves the way the eating disorder voice wants us to treat ourselves. And then I noticed in developing a more self-compassion, shout out to Dr. Kristen Neff for her book, Fear Self-Compassion. It's like, that also helps me show up differently. Because I'm like, if I'm not going to accept it from my own internal voice, I'm not going to go accept it from being oppressed in the workplace or being abused in other aspects of our life. But I also think in our society that's very fast paced and it may feel challenging to face our emotions. It's easier to say, well, I'm going to hyper focus on this weight goal or this food goal because it distracts us from feeling. So I just say that as like an observation in case someone's like, why am I stuck in diet culture? And I also get mad every time I see commercials that used to wheel me in. Now I'm like, now they just want my money, Right. And I'm like, now they just want me to be smaller and to not only smaller like body, but just like quieter. Because when I was didn't have enough energy, I wasn't speaking up. I was like barely getting up and putting all my energy to doing my job.
Yeah, no, that's one thing I've really started thinking about and questioning is, who is benefiting from all of this, right? So the people, by and large, like the majority of the people who are wanting to change their bodies are women. And then I'm like, who are the people telling them to? And I'm assuming it came somewhere from a man, right? Like I'm just assuming that. I don't know who started Weight Watchers and Jenny Craig and all of these things, but I just feel like in general, men have ideas about what women should look like. Those ideas have been put on women over the years. Women have adopted those ideas. And so we think it's normal now, but then like when you really think about it, it's like, who is benefiting off of me hating myself? And I'm not benefiting off of it. My children aren't benefiting. My husband's not benefiting. I'm not doing anything to like uplift society or make a change in the world or a difference or anything like that. Like the only people benefiting from me hating myself are the diet companies, whoever's making the pills and, the weight loss trainers and all those people. Like that trainer I hired who was just awful, it charged me $5,000. He was benefiting from my eating disorder.
Yeah. And even when I was thinking like eating disorder treatments are costly in themselves, like everything is so challenging when it comes to the way that our society manages weight. And then also finding an appropriate program. If a person, of course, we can't speak on the programs themselves, but just know if you're in a program that doesn't feel like it's helpful. One, there are periods in my life where I wasn't, it was me, it could have been a great program, but I was resisting. But there are some programs, like you said, that are traumatic, and making sure that you find a trusted individual to support you. And
I think it's also, I was just going to say, important to realize a lot of diet programs, they've gotten smart, right? So they aren't necessarily out there saying, I'm a diet and you're going to be restricted and hungry. They don't say that anymore. They've gotten smart they'll say lose weight without any difficulty, or lose weight and not experience cravings, lose weight with the food you love, healthy food, wellness, like all of these other terms that sound good, right? Like, who doesn't want to live healthy? Who doesn't want wellness or to be able to lose weight eating the food you love? But they're just still diets in a different name. And I always tell people, if you're on a program that tells you what to eat, when to eat, or how much to eat, that's a problem. That's a diet, right? Because we should be able to decide that for ourselves, not some external source.
Yeah, I was obsessed with diet culture for a really long time, to the point where I tried to combine all the diets, and I ended up with nothing because the contradictory. And they're like, well, you just have to figure out what's right for you. And I was like, none of that was ever going to repair the relationship I had developed with utilizing any way that I consumed or didn't consume food to help me feel numb. Like, none of it was going to actually, it was distracting me from feeling.
Right.
And you have a Facebook group that's been a very safe place to explore these feelings. Could you mention what that's called?
Yeah, so the Facebook group's called End Emotional Eating Now. And I do have a very strong interest in emotional eating. You were talking earlier about depression, and that was one thing that I learned when I was in treatment, because thankfully the treatment center also had a what they called a mood disorder center with it as well. So the psychiatrist was an ED therapist, or excuse me, an ED trained psychiatrist, but also was evaluating people for depression, anxiety, and other things. And I didn't realize how often those go together, or in how I was feeling depressed and trying to deal with the depression through eating, but not even realizing that that's what was going on. And so certainly there's a big component of that. And then you mentioned, having to learn to feel your feelings. And so when I think about emotional eating, I think about all the times whenever I was any kind of negative emotion, scared, frustrated, whatever, trying to procrastinate, to make myself feel better, I would eat. And it worked, right? Like, it would work temporarily. I would eat and I would feel better. And so, it was kind of like this habit I had developed. And anytime I felt bad, my brain was like, go eat, because when you eat, it makes you feel better. And now that I'm not doing that anymore, it does require being more in tune with what my emotions are and my feelings, recognizing what it feels like when it comes on, in my body, really taking time to ask myself, what do I need in this moment? I know it's not food that I need, because I'm not hungry, or I just ate. What do I really need in this moment? And so it does take more work, I think, for me to tune into my emotions and do self-care to fix, work on those emotions. It was much easier when all I had to do was go eat.
Yeah, I agree. I agree. It felt much easier when I was completely numb. And it was also a life of very poor quality. And I am thinking back now too of the amazing community we just met at ACE. And when we reflect on those times where struggles could be very prominent, or eating disorders can avoid genuine connection, like, those are the small wins throughout the day that I think it's good to highlight. Because I know for me, the recovery journey was, it hasn't been linear. There's been periods in my life where I'm always prepared to tap back into resources that are helpful. And what I learned now is that I used to have that guilt of like, I can't believe I'm struggling again. I'm like, nah, that's just part of what it is. And that's where self-compassion comes up. And I really appreciate you speaking about.
Yeah, and one other thing, I think, and again, diet culture has done a really good job of making all of us think it's our fault that we can't stick to diets. And so many people are like, well, I do this diet and I do a great job for a few days, and then I give in, and then we blame ourselves and say, I just need more willpower, or maybe I just need to go find another diet. And we never realized that the problem was with the diet, not with us. And, or maybe even that we do have an eating disorder, or even if it's not officially an eating disorder, we've moved into that territory of disordered eating or pre-eating disorder. And we're not even realizing it. We just keep thinking it's something wrong with us, that we're doing it wrong. And that's what diet culture conditions us to do, because when you think again to who's benefiting, the people who are making money off of us, not liking ourselves won't make money anymore if everybody starts saying, I'm going to love myself now and not try to diet.
I was just thinking something that made me feel nice inside when you were commenting at part of the AIDS community. You gave a talk and we were talking about garments, and I've often felt like, oh, I can't show up because none of my clothes fit. I said, well, if you don't have underwear that fits, what do?
Buy a bigger underwear.
You just go buy dang new underwear that makes you feel better.
Right.
And I loved that, because it's like, and if you just don't feel better and good in your clothes, you just go buy different clothes. It's not a you problem. It was that outfit problem.
And I don't want to say it's really easy, because certainly my first shopping trip to buy bigger clothes was incredibly traumatic. Like, I didn't prepare very well for it. I thought I could just roll into Target and get a dress and it was going to look great on me. It was awful. I was like breaking down in the dressing room. And so, I mean, it can be very traumatic, but as I've worked through that, you're right. Just having clothes that I think are attractive, that fit my body, that I'm not putting on and feeling like, oh, I've got to suck in my stomach, or as soon as I put that on, I'm like, oh, I got to lose 5 pounds. Just having clothes that fit and I look good in them has helped so much, because before, when everything was too tight, or I always had like these goal pants or whatever that I'm trying to get into, all my thoughts were around food and how can I get smaller to fit in those clothes. Well, now my clothes fit, so I don't have to spend mental energy thinking about how to get smaller to fit in my clothes.
And I think that's such a good point to highlight the emotional connection with eating disorders, because I was thinking, as we're talking about, I can wake up in the morning wearing one outfit that at the nighttime I want to like burst out of the seams emotionally, because my stress level has changed. And therefore, like the texture of the fabric is it just is too much. And that's because it's an emotional, this is a mental health condition. So it was never the clothes issue, but sometimes the games that the marketers play at the stores where we're trying on clothes, like we just always, again, it's like, it's so hard to develop self-compassion. It's so much easier to say it, but if I go into a store, some days I know it's not a day I try on clothes. Like, I just know today's not the day. I might get this because I like it and I'll bring it back. And then there's some days where I feel like it, or some moments where I feel like it. And just because I felt like it walking in doesn't mean that, it can trigger something, and it's acknowledging and loving. And sometimes I flick off society, because during my extravaganzas with trying on clothes, because I'm like, I know where this came from. As little kids, we never would have thought anything negative about ourselves. If we tried on anything that we didn't like, we would just take it off,
Right. Yeah, no, I guess, so that brought up two things I wanted to say. One is, I hope the people listening to this can tell. I mean, this is a really complex issue. And so certainly, if you think you are struggling with this, please go get help. Obviously, people like Jillian and myself, we can provide peer support, and support you, but you really do need a team trained in this, just because of how complex it is. And then the other thing you said, you were mentioning kids. And I think that's a thing now that I am really focused on, is how can I keep from passing this on to my kids? What messages were given to me as a child that helped to, even if it didn't specifically lead to the eating disorder, it maybe led to some bad body image or, disordered eating. And so now that's my focus, because I have 2 little kids and I'm like, okay, I don't want them to have to go through what I went through.
Yeah. And that's, I was mentioning the Sunny Side Up nutrition from my dietitian. When people ask me, I always say, I often don't give eating disorder advice necessarily, especially when I don't, because again, we're not eating disorder trained, but they call it the blind spots. For me, I'll say my blind spots are, I think through an eating disorder lens. So something that sounds normal to my brain, like I like to be in an environment where there are people that have never had an eating disorder as well, that can normalize that, like, oh, that's a little bit interesting that you do that. And I like working with my psychiatrist now, and I bring to her attention some interesting articles, like, what's your read on this? Because here's what my brain says, and when can I trust my brain? And I'll say that's been one of the most frustrating parts of my journey is, when can I trust my brain now? So always having a person that, again, I'll rely on that eating disorder trained individual, especially because I know that Trina might get it, but also Trina's got her own journey, and I'm not gonna insert myself, because you just never know where somebody's at in that moment on that day. So I think it's very important to have that additional support.
Yeah, and I still see my dietitian, and I mean, I probably could not see her anymore, but it's for that reason, because sometimes just the thought will pop in my head, like, oh, well, that diet that they were advertising on TV, I think that's the one, that's the one that's going to work. And so then I go and tell her. And so she's really good about getting my mind, back on track, breaking through all of the kind of false stories that I've told myself and convinced myself.
Yeah. And I like to have a psychiatrist that I kind of don't like. I love my former psychiatrist, but what I mean by that is somebody that doesn't enable me and they challenge me, because I was often told, like, people with eating disorders, we want to fix everything aside from the food and our relationship with exercise. For me, this was true, right? I wanted to intellectualize the eating disorder, but that was my way to avoid actually doing the steps I needed, because the steps we need to recovery, for me, I'll equate it back to the addiction. It's like, it's often very uncomfortable. And for me, I had a lot of anger that was coming out, and that if a loved one was around me, I'm like, that was just me processing something that was really uncomfortable. And I think it can be scary. And again, that's why it's so important to have eating disorder trained individuals that can help mediate that family and support and guide and have expectations, because it's better on the other side, but it's not glamorous to journey there.
Yeah, and I would say that for me is actually where a life coach was helpful. And so, sometimes people ask me, if you're not an eating disorder trained therapist, how can you help people? And so I'm not specifically in my coaching niche trying to focus in on people with eating disorders, but there's still a lot of other thoughts that were going through my head that my coach was able to help me with. So even there, I had a lot of just shame and like negative stories I was telling myself, like, oh, Trina, you're a loser because you have an eating disorder, or, you're a loser because you haven't figured this out yet, or, all these kinds of stories, or even when I had to take off of work, like, you're a terrible teammate, you're taking off of work. And those were often stories that my coach was very good at helping me with, and just kind of helping me challenge those thoughts and move forward, with my thoughts. And so for me, it was actually perfect to have a coach, the therapist, and the dietitian all working together. And the coach also was really helpful in, helping me see that it was up to me. Like, it was within my power to decide how I wanted to show up for eating disorder treatment. And I was going through this journey, because at first I had a victim mentality. I was just kind of like, poor me, I have to go to this treatment center. And my coach was really the one that empowered me to, instead of going from poor me, to look at this amazing opportunity that I have. And that was actually my mentality the whole time I was going through treatment, was this is an amazing opportunity. And I think that's one reason that I was able to get better, because of shifting my mindset.
I think coaching also, I 100% in agreement with you, is I did a lot of therapy and dietitians and all, levels of care. And it helped me to get to a point where I was sustaining life. And then coaching helped me to move forward. So I really value the role of the coach. And often it's that coach that, once you celebrate, hey, with your therapist, like, I think I'm at a point where I can do this, having that additional support, because you want to keep that momentum, and we certainly don't want to put you off on your own to tackle the world. Can you tell us about what your current coaching programs look like, and where are you at with it right now?
Yeah, no, well, it's definitely been an evolution. So whenever I first started as a coach, I was doing divorce because I've been divorced before. And so I knew I wanted to help divorced women. I still feel very passionately about divorced women, but then after I came through treatment, I was like, okay, I want to help in this area in some way. And I think it has been an evolution, me trying to figure out exactly where I fit, within this world. I just know that I want to help people have a healthier relationship with food. I want them to have a healthier relationship with their bodies, exercise. I want to help deconstruct some of these myths that are out there and some of these beliefs that are so ingrained in us. Like, I definitely think there is a role for a coach in addition, to therapists, and to break down these beliefs, because diet culture is so pervasive and it is so strong. And so I know that the end result is I want people to have a better relationship with food, a better relationship with their body, more confidence, more self-compassion, and not feel that they always have to be on a diet. And then I really want people to think about their life, right? Like, I've started doing this more and imagining, when I'm at the end of my life, when I'm looking back on it, like, do I want to just be thinking about everything I missed out on because I was afraid to go eat, or I was afraid of the calories, or, something like that. Like, I think maybe we don't think about it when we're in it, right? Like, we're in our 20s or our 30s or even our 40s, 50s. We think we have a lot of time left, but then I'm like, really, every day is passing, right? Like, every day that we are not allowing ourselves to live life because we are ashamed of our body, or, whatever, we don't have a good relationship with food, that's a day we can never get back again. And so I want to help people with that in some way.
I love that. And it's something that I feel strongly about too. And I was just thinking the balance of how challenging it is to get over the eating disorder, because when I lost my ex-boyfriend, passed away in 2016, 2017, I was out of the military, and I struggled for 5 years and didn't find the ground beneath my feet to say life is worth it. I'm gonna, that needed hardcore therapy. And found Sunny Smith's Facebook group. And again, actually coaching was helped me to see the light. And then I did think life, like I see hope, and then you get the appropriate resources to live there. But it's that just put to my head, like, how strong an eating disorder can be, an eating disorder voice can be, and the importance of the support and the voice that you are putting to this, the awareness, and saying, hey, you're not alone. You deserve help. Life is too short. We love Trina. Thank you, Dr. Dorrah. I appreciate you so much, because this is, for the people that are stuck in this loop, to hear the voice, hopefully it'll provide them that courage to take that step off, and start living that meaningful life that we know is out there. And any other lasting tips that you want to leave with the audience?
Yeah, I mean, I guess I just kind of think back to what I was feeling before I sought treatment, and there was a lot of fear, I guess, shame, uncertainty, just, not knowing what it would be like, afraid to give it up. And I guess I would just say, and I think you agree, now that we're on the other side, it is so much better. Life is so much better on the other side. So no matter what your brain might be telling you, that it's better staying where you are now, restricting your food, not hanging out with friends, thinking about food all day and being obsessed with what you're eating and what you look like. And even though you may think that's better, I think both of us are testaments to it's actually better on the other side whenever you have freedom, food freedom, or freedom from emotional eating, freedom from eating disorders, all of those things.
Yeah, it's interesting to feel comforted by the miserable because of the discomfort of the unknown, right? And I remember I would hope we can help people that are in that messy middle, because I've had to hit rock bottom too many times, and that rock bottom. It takes us longer to climb back up if we can climb back up. So if you're saying, hey, I think my life can be a little bit better, what's the next step? What's the next
Right.
best step?
Right. And one other thing I wanted to say about that, because you highlighted it, eating disorders can be deadly. And I don't know that everybody always knows that or thinks about that. And so, this isn't something to take lightly. And so I think that's why Jillian and I are here, talking to you all. It's not that I just want everybody to know my personal business, but I think we both feel like if we can save somebody else, then, it's worth it. And I'm sorry, what was your question?
No, I think you're highlighting that point, is that last tips, and what you're highlighting too is so important. I know for me, hearing anorexia is one of the top psychiatric illnesses associated with death and suicide. We'll make sure not to do too many, trigger things here, but we'll go ahead and put links to your information as well as suicide resources. When we are malnourished, our brains do not think, and this doesn't talk about weight or anything. So oftentimes I think we can do a disservice by naming, not us, but in terms of just the DSM and putting diagnosis to things, because malnourishment in the mind, regardless of weight, can have detrimental outcomes with the way that we think. And the suffering that eating disorders cause mentally is something I wouldn't wish upon anyone. So it has been frustrating, right, to be in a world where often people can't understand us. I have learned to appreciate when I'm misunderstood, because I'm hopeful that person doesn't know the suffering. And when they do, we come together and we try to create a space of healing, and acknowledge that we think it won't happen to us. There are times my brain is in denial. I don't feel like it was me. We dissociate. It's, so if you're feeling that way and you think, she's not talking about me, but am I, so I want to put that out there. We'll make sure to put your information below. Are there any other resources that you'd recommend checking out?
I'm just trying to think. No, I don't know that I would want to specifically refer to any that I don't know about. Right, yeah. I went through a treatment program called Eating Recovery Center, and it was wonderful for me. I know, what was the name of the program you went through?
I went through very, very many.
That you felt that you felt were helpful.
The eating disorder programs that I went through that were helpful, one of them is no longer in existence. It was in Chicago. And I'll say the type of program that was most helpful for me is one that was no BS, meaning it had me do the things despite my brain wanting to tell me no. So I'll say in general, what was most helpful for me was getting my brain up to a level of nourishment where I could think appropriately. Again, this doesn't mean weight-based. This could be anyone that's restricting below what their brain needs. I was severely depressed until I was eating well enough to think straight. And then it was being with any therapist that I trusted, which it took a lot for me to trust a therapist. So Dr. Maria Lavia, she is one of my saving graces. I know she can't treat everybody, but what I loved is that she called me out on the things because I could intellectualize my way. I mean, we know, you know how the system works, and you know what to say, and for her to call me out and for me to trust her was really helpful. I'll say the challenges I faced as an adult were getting myself to stay, thinking I deserved treatment. So finding a treatment team and support that believed in you, that valued your life. And so I would say even beyond the treatment teams, it was finding that community. So again, we just came from the Authenticity, Courage, and Empowerment conference. Finding that community of people that brings out the best in you. Because what was challenging for me was I get discharged into diet culture, discharged into a weight-based stigmatized medicine culture. And it was very hard for me to sustain a mindset that was like, oh, I have to do the opposite of what everyone's telling me to do when my brain really wants me to do exactly what they're telling me.
Right.
So I think, we're highlighting the complexity and just getting
I'm sorry, go ahead.
I was just saying, we're just
one thing. Oh, sorry. I just wanted to say, when you were asking, like, where can people go for help? We've kind of alluded to it, but not everybody can treat or is trained to treat eating disorders. So, if you are going to seek out help, try to find a therapist who is trained in eating disorders, or a psychiatrist who has training, a dietitian who has training, because otherwise it could, in some ways, maybe be more harmful, or you just don't end up getting the help you need. So if you're on this journey, you're just trying to figure out where to go, certainly look for people who actually have that training, because that was another thing I learned on this journey. Everybody else doesn't learn this. I didn't learn it in med school. Dietitians don't necessarily learn it. Therapists don't necessarily learn it unless they go get extra training in eating disorders. They aren't all experts at it.
Yeah, and if anyone that's listening wants to message us any free resources that there are online, I vet all the resources, just because online you can have people that say things that are very helpful, things that are not very helpful. So if we're noticing good resources online that have free resources that are helpful, and we like to call them safe and aren't having anything that can cause detriment, then we'll definitely share that. I can share that in the show notes. But Dr. Trina Dorrah, appreciate you so much. Again, we'll put your information below. People can go ahead and ask Dr. Dorrah questions, find out where her coaching is, her Facebook group is, listen to her podcast. If you have any questions for the both of us, please let us know that too. And until next time, I appreciate you being here.
Yeah, thank you so much.